Hi, welcome everyone, and joining our regulatory sharing today. And this is our third, actually fourth section in terms of sharing by our regulatory circle, supported by TechBuild and also me from ARPA and Christelle as well. So me and Christelle is like the chair and co-chair for this group and look after this vacation circle. And feel free to join our WhatsApp group for this network. And we are having different regulatory topic every month. Previously, we done Singapore, we done AI risk management, we done Europe and UK, and this week we are doing Indonesia. Next month we are doing Hong Kong, and then further month like October we will do US, etc. So each month we will try to invite speaker, particularly local speaker, because when we talk about Indonesia, we have a Indonesian expert located there, so that is there more local experience like that. Okay, so I would like to introduce our speaker today, Ryan. Ryan Teo is the Director of Garuda, Singa and Dragos GST Management Limited. He worked in the role of within the public healthcare sector and private sector in multiple countries and over more than 10 plus years experience. He delivered over USD 20 million worth of a project value. As part of his work, he helped a lot of companies to set up their mobile ECG joint venture between Singapore and Indonesia previously. So he's one of the experts to help company enter a market, find their first sales in Indonesia. So if you're interested in Indonesia market, you may contact Ryan for some advice. And today's topic will have roughly 25-30 minutes to share about the medical device regulatory process in Indonesia. And then we have some 5 to 10 minutes Q&A. We will record our section in YouTube just in case you missed the section or you want to share with your friends accordingly. Okay, so Ryan, without further ado, I pass to you. Thank you.
Not all of them.
Okay. Thank you, Jack. Thank you, Crystal, and to the Tech Bros community for giving me the chance to share. First and foremost, can everyone hear me clearly?
I can hear you, no problem.
Okay.
And for the other colleagues, please mute your mic accordingly. Thank you.
Okay, so first and foremost, welcome everyone, right, to this very interesting and boring topic. I'm not too sure why you guys are here, but welcome to learning about Indonesia healthcare market. Okay, and I'm very glad that this is done online because actually I'm an introvert. If I were to do this in front of a room of people, I think I would be too scared. So, yeah, if you have any questions after the talk, then please feel free to ask. Right, I will go through this material relatively fast, but I think the slides will be shared after this, so you can actually also follow up. Okay, so overview, right? First, I'll start broadly in introduction to Indonesia, and then to the healthcare market. Then after that, generally the regulatory landscape, and then we will go through the process for how a medical device company will obtain a registration and approval. Okay, and although I think Jack introduced me as the expert, but honestly, I do rely on the help of my Indonesian colleagues, and friends, right, to actually help to navigate this large market. Okay, so we will come back to this slide multiple times in this presentation. Generally, I think to give people an overview, there are about 8 steps in this process, right? So as long as you broadly follow this process, right, this 8-step process, right, I don't think there'll be much problems with your medical device registration. Okay. So if you are not able to absorb everything and you can take away only one thing, just remember this diagram. Okay. Now, firstly, introduction to Indonesia. I think Indonesia is interesting market, right? It has a lot of potential, but I think from a healthcare business perspective or from an investment perspective, I think it's often overlooked by people in the region. But nonetheless, actually, it is a rapidly developing market, right? It is actually the fourth largest population in the world, and within Southeast Asia, right, it's actually the largest economy, right? So normally people's go-to-market strategy is Singapore first as a hub, and then you explore other Southeast Asian markets, right? So you may want to consider after setting up your hub in Singapore to consider Indonesia as your next market, right? So for people in the healthcare business, I think it's interesting to know that in terms of the national policy, right, there is this medium-term national development plan for the next 5 years, right? So this is how they will be developing the national health strategy, right? And also importantly for people who want to enter the market, right, you should take into account the National Health Insurance Scheme, right? In short, BPJS, right? And about 90% of the population is on this scheme, right? Which means to say that, for example, if you are a medical device company or pharma company, right, you can see whether you can get some form of reimbursement, right, for the patients, right? For example, for dialysis, renal treatments, right? So this is quite important to help defray the cost, out-of-pocket costs for the patients, right? And then the current health minister is Bapak Budi Gunadi Sadikin. Okay. So Indonesia is a very large country, but I think generally it's very similar to how each country's healthcare industry is governed, right? Of course, you have the Ministry of Health, correct? But as I like to mention that because Indonesia is very large, right? So besides your urban population, Jakarta, the capital city, and Jogja or Bali or Medan or you see, besides your capital cities, there's actually a very large rural population. So if you are implementing some of your marketing or some of your partnerships, you may have to work with, for example, the Ministry of Village, right, to really go down to the granular level, the village level, right? And then, of course, I mentioned, for example, if you see this, there's a BPJS, which is under the National Social Security Scheme for reimbursements, right? And also your BPOM, right? Okay, so this is a general overview of the healthcare market. Okay, for pharmaceuticals, right? Because of maybe cost consciousness, right? I think generics, branded generics, OTC, would form the majority for pharmaceuticals. Okay, and then for medical devices, right? What's interesting is that actually the majority of the medical devices are imported, but generally, if you're going to the market, right, the government policy now is to support some form of tech transfer or local manufacturing. Okay, so this is something to take into account, right? That you might need to plan for. If there are certain parts of your process that you can incorporate locally, right? That might be something that you need to plan when you are setting up your operations and your corporate structure. Okay? Generally, last time, before 2021, right, the healthcare industry in Indonesia is somewhat controlled or regulated, right? But as you can see, from 2021 onwards, right, generally the government is more open for foreign investors to come in, foreign companies to come in, right? So depending on which area of the healthcare industry you're in, right, you can see that currently many industries are open, and you can even own up to 100% foreign ownership. Okay. Now, for the regulatory body that you will probably come under, okay, it'll be the Ministry of Health, right? And this is the website that you can go and take a look, right? So broadly, the Directorate of Medical Devices and Household Health Products Evaluation, and also the National Agency of Drug and Food Control, BPOM. Okay, so I think preparing your documentation for the Indonesian market is not very different. If you have already submitted for example, your US FDA or your EU or Singapore's HSA or Australia's TGA, right? Generally is following the ASEAN Medical Device Directive. And so all you can probably use most of the material that you have prepared previously, right? Just that you might need to translate it to Bahasa Indonesia and legally notarize it. Okay, yeah. So that's a point to note. Okay, and then this is general for not just any healthcare company, but companies that are going into Indonesia, right? You would probably, as your first step, think about setting up a private limited, or in this case, a PTPME, right? Or LLC, right? Limited by shares, right? And like what I mentioned before, there are certain public policy benefits for setting up a certain percentage of your manufacturing locally, or as much as possible, right? And then for the for the healthcare industry, you need to work with a authorized local representative with the medical distributorship permit or license. Okay, so generally, when you are looking at your medical device, right, there are 8 steps to it to finally being able to be able to have your products in for the patients in Indonesia, right? First is you want to know which category of devices you're in, right? Class A to Class D, right? Depending on the risk. Then you will have to find a local representative to work with, or you can apply for the distributorship license, right? So then you prepare your documentation, right? Then you go to the Ministry of Health website, and then you submit, create an account, do your online application. Then the Ministry of Health will send you an invoice, right, for the payment of fees for them to start the regulatory review, right? And then the next step will be regulatory review based on the documentation that you submitted, and probably there might be a few clarification rounds, right? Then once everything is successful and you get approval, you will get a license, or the NIE license, right? And then after that, post-market, you need to regularly monitor your products in the market for patients. Okay, and then I will go more in depth for each of these steps. Okay, I'm sure everyone in the audience is quite familiar, right? So Class A to Class D. Class A is the low risk category. Class D will be your high risk, right? So generally quite similar, right? You will get you will have to work with a distributor that has the license. Okay, and the license will be IDAK, basically a medical device distributorship permit, right? And then generally there are 2 kinds. One is for the medical device, and then one is more for your household or lower risk kind of household healthcare related products. I mean, you say for example your cleaning, your antiseptic, that's your PKRT, right? So if you look at this graph, generally I think the number of distributors, the light blue column, right? Generally there are about 2,000 to 3,000 distributors in Indonesia that you can work with for your medical devices, and this number is roughly constant, doesn't really change. Right. So after you find the partner that you want to work with, you assess the few distributors, you can also start preparing your documentation, right? So the administrative documents would be your company documents, right, where your products are coming from, etc., and quality certification. Your technical documents will depend on your product itself, so it depends case by case. But basically, you're following this ASEAN Common Submission Dossier template. So good news to those people who have submitted for HSA before, right? You can actually find the process very familiar, right? So they'll help to shorten the amount of time and effort also, right? So like what I mentioned, right? You will go to the next step would be to go and create an account on the Ministry of Health website, right? And then make an online submission. Normally, this process you work with an agent, right? I mean, because it can be a bit complicated, so that's what we advise. Work with a regulatory agent, or your also your Indonesian legal firm, right? So after that, they will send you an invoice, right? And then this is generally the amount of fees that you might need to prepare. It's not a lot, honestly. So just for reference, Class D is about 350 USD, right? So this regulatory review, I think is something that many people are concerned with because of the amount of time, and you need to factor it in, right? So just as a rule of thumb, or right, your Class A, which is low risk, you'll take maybe about 15 to 45 working days. So that'll be maybe about, if you think about 20 working days as 1 month, so about 1 to 2 months for Class A. Then for Class D, probably you need to budget about 6 to 7 months, right? In terms of the actual time that will lapse. So after you have passed the regulatory board, right, you will get approval, and you will get a distribution approval number, or NIE, right? No more izin EDA, right? And this is typically given for some time period. So you need to note how long it's valid for, and you just need to renew it. So after your product is in the market, okay, then you need to monitor for any issues, right? And you need to report it within 48 hours to MOH, and you need to provide regular tracking, right? So it'll be good if you have some form of device tracking system or some way to manage, basically, So please ensure that you have something like that in place, right? And also the circumstances will depend, because Indonesia is very big. So you need to take into account how your devices are being used now. Right. So just as a recap, okay, there are 8 steps to this process. And as long as you follow this process, you shouldn't have much issues, right? And then depending on what's your medical device, right, you need to prepare your budget and the time estimate accordingly. Okay. So let's take an example that I prepared, right? Maybe, for example, it's a Class C device, correct? Then you need to have some time for setting up your PTPMA, your local entity. You need to go and select your distributor that you're going to be working with, right? Then you need time to go and prepare your material, get it translated, get it notarized, get the lawyers to look at it, right? And submission, right? And then you need to submit for review. So I would say in total, maybe for something like a Class C device, right? As a rule of thumb, maybe you need to prepare about 8 to 11 months for planning. So it might essentially be almost, 3/4 of a year to even a year, before your Class C device can actually be on the market, right? And I guess the total professional services cost, probably you need to budget maybe about 33,000, or something like that, just for all the professional services incurred, correct? So I would like to pause here. I may have gone a bit fast, but are there any questions so far from anyone in the audience?
Thank you, Ryan. I think Indonesia is a big market. At least in terms of population, this is definitely a huge market. So a lot of potential there. But normally, startup don't go Indonesia first. Can you share why, or is that misconception, or that because they go Singapore first, then go to other Southeast Asia countries? will there be different perspective that no, you should go Indonesia first for many good reasons? What do you think, Ryan?
It depends on whether you have good Indonesian contacts in the healthcare industry, right? Because let's say, for example, from work previously, right? When I helped my boss set up the joint venture, right? And it happened that my boss's boss was actually a Singapore doctor who already knew his Indonesian doctor counterparts, right? So it's very easy to get started there, correct? Because you already know someone that you can trust to navigate the system, to help introduce you to other doctors, to other private hospitals, or I mean to other clinics also, right? Correct? Because if you have that local contact already, right, either through your own business network or your own friends, right, then please go and target Indonesia first, right? But if you're generally just coming to Southeast Asia first, right, I think Singapore's HSA within Southeast Asia, I think is kind of a reference for the rest of the region. I'm not saying that because I'm Singaporean, right? It's just generally, it's the language used is English, right? So whatever you submitted for other jurisdictions, correct, would be almost the same, right? But if you want to submit for Indonesia, you have to undergo language issues. The legal system is also slightly different, right? And then business-wise. So that would be my answer to your question.
Right. I think there's an important message to the participant or in the future the YouTube viewer is it's not always you need to go Singapore first. You can go Indonesia first. For example, like Ryan mentioned, if you have the people there, the network there that make things happen, then it also makes sense. Even though Indonesia process language is more work, but again, Indonesia is a bigger market than Singapore. So sometimes why not go to a bigger market first? That's also another important attraction for the team to consider. Thank you, Ryan. And I see there's some questions.
Can I just add on to that
Sure.
reply, just to emphasize a bit? Indonesia is very big, so there are different market segments. Why do I say this is important? Singapore is generally a developed market, right? Even though it's small. So the propensity to spend for healthcare might be larger, right? But Indonesia, besides the capital cities or middle income and above, there's also a large rural population. So if your product, is maybe more suited for a large rural population, right? Then please go to Indonesia first. But if your product is targeting middle income and above, or something, for example, like branded pharmaceuticals or branded or slightly higher on the price range, then you might have to consider how to, adapt your strategy a bit. Yeah, so that's all. Thank you.
Thank you. There's a question from Angel here. If you have other country approval, for example, US approval, Europe approval, or Singapore approval, does it have a quicker approval in Indonesia?
Of course. if you have FDA, which is a gold standard anyway, it helps, right? HSA is also useful, like what I mentioned, because you are following or if you're submitted for any other ASEAN country and you are following the common submission dossier template, right? Then that helps, right? I won't say you can use 100% of it, okay, but you can definitely use the majority of it, the documentation that you prepared. Yeah.
Right. One thing the team sometimes confuse is if you got some approval is good, but what exactly mean is government, they want to get some confidence. If this is an advanced country, like US, Europe, then they will more comfortable to approve their product, for example, Indonesia. So HSA approval, I think also consider helpful, right, Ryan? But not all approval help, right? If some country, the regulator don't even know them too much, then they will not take it too seriously. So that may be the situation. Is that a fair comment, Ryan?
I think that okay.
Like if you got
The
approval in Africa, one of the country in Africa, maybe Indonesia government won't take it too seriously, right?
okay, I think generally if you have the US FDA or EU's approval, right, then this kind of the gold standards for everyone, correct? Even for Singapore, right? If you have got that, then you know, that generally maybe it'll be held in higher regard, but don't quote me on that. I mean, it's just general, right? Not to say that Africa doesn't have a good regulatory framework in place, right? But I can't say that, right? So I'll say that
Yeah.
it depends. There are various ways to mitigate it, right? If you have your statistics to back it up, right? Or you have collaborations with certain well-known KOLs or famous institutions, that also helps, right? You see, so
Right.
that I think there are various ways to mitigate it. It really depends on your case by case strategy. And like what I mentioned, right? If your solution is something that helps, the scenario that your solution is working for helps for a large rural population, for example, right? And it's almost directly applicable to the use case in Indonesia, then it really doesn't matter which country that it was previously approved, right? Because the use case is directly solving the problem on the ground, correct? So in
That
that
makes
case,
sense.
yeah, you see, so that's how I would try to establish my case, for a smoother approval process. Yeah.
Excellent.
I hope that
Thank
answers your
you.
question.
That's helpful. Thank you. One I find it quite a tricky question is, can you have more than one authorized agent in Indonesia? The last question in the meeting chat.
Maybe I can answer it in this way.
The thing is, sometimes I
think
think I remember you mentioned you have a team as well. So if you want to check with your team, it's okay. We don't necessarily must answer now, but I think it's just a good question. Yeah.
this I will need to check specifically, but
No
generally
problem.
you start with one. No, generally I think you start with one agent first, right? After you assess several, right? Before you decide on working with one, and at the same time, right? It depends on how you structure the business. This is more commercial agreement, commercial arrangement, really. Because like what I mentioned, Indonesia is very big, and there are multiple big islands. Like Java is one, for example. So when you are talking about a large country, right, you cannot just have one agent to cover a large market, right? So depending on how you do it, maybe you work with this one agent first to get your product in the market, right? Then subsequently they become your master distributor, or you tell your master distributor that, hey, for this region, we identified this other business that might be better, right? Stronger in this region, or certain market segment, for example, right? So I feel that might somehow answer your question about, or your concerns behind, like,
But
do you
that's a
have more than one
commercial.
other? Yeah,
That's a commercial side. Sometimes the regulatory may not allow. That may be
correct.
the situation.
So that's why I would say normally you would only have one authorized agent, right? And then after that, they have distributorship for certain area. And then if you want to extend that to other region, then you have to see how to work it out between your first authorized agent and the other distributor, like a sub license or something. Yeah.
Thank you. Thank
Yeah.
you.
Because Indonesia is
Um,
too big. It's like China,
it's
right? I
it,
mean, no one can
yeah,
or US, you can't have one agent for one distributor. Yeah.
yeah.
Sorry,
It
sorry.
is
Yeah.
very common problem in Asia for about multiple so-called agent, authorized agent, because once you stuck with one agent and then
Hard
you
to
found them
change.
they are no good, You want to
Correct.
separate from them? Difficult, particularly in Indonesia. Sometimes the ownership of company, sometimes the law or regulation don't allow you to have another one. You cannot just, register the product again because they only allow one agent. So that's quite a common challenge in Asia like that. But thank you for your input. There's one more question at the end. At the end of the mid chat is e-catalog system in Indonesia. Can you share a little bit about this e-catalog system?
Sorry, can you clarify what's this e-catalog system? Maybe I'm a bit unaware also.
Okay. Tiffany, are you okay to explain your questions?
What's this e-catalog system?
Hi, can you hear me?
Yeah. Thank you.
Hi, sorry. Yeah. So, as I'm aware of that, for those medical devices that need to be purchased by the public hospitals, they'll need to be entering this e-catalog system.
So
But I'm not
remember,
sure whether or not there's a strategy, like when we want to register this.
yeah, so remember at the start I mentioned the BPJS insurance scheme. Oh, it's like GBs.
I think it's for centralized procurement system that is a single online marketplace for government to buy their goods and service like that. That may be how it works. But Tiffany, you have any particular question about this e-catalog system? Or how easy to go in, how long it take, or you have a particular questions?
Yeah, so regarding this, I'm thinking like whether or not it's tied strictly to what we have registered. So for example, like I'm not sure, like for purchasing, do we need to only register what we have already registered in Indonesia, or like every device that we register in Indonesia will need to go into this e-catalog system so it can access to the whole market.
Oh,
Yeah.
that one, again, Ryan, you want to comment or you can comment later. But according to my research, this e-catalog system is mainly for government. It's not for all sector. But please share with me, what do you think?
Okay, I think I will answer by saying that, remember at the start, I also mentioned about the National Insurance Scheme, right? The BPJS. Yeah, so maybe I think you look at it broadly first. Like, are you able to get registered for the BPJS first, the National Insurance Scheme first, right? Because regardless of whether the patient goes to a public hospital or private hospital, then they can get subsidized, right, from that National Insurance Scheme, correct? Then this e-catalog is a subset, right? Correct. Because like what the Jack really mentioned, right? This is only for the public healthcare. The civil service. The public system, right? So you should consider whether it falls under one of the things that people can claim for in the BPJS. Then also maybe you look at if you are planning to have public hospitals as your customer, right? Whether it can also fit into the e-catalog system, right? And then for this, you will need to definitely work with your local Indonesian business partner to figure out what's the process like. Because on this one, I'm also not an expert. For questions like this, normally I will work with my Indonesian counterparts for it. Yeah.
Sure, thank you.
Again,
I do some research.
Yeah.
I share some research answer with you as well, Tiffany. You can have a look later.
But I want to add that, I think depending on it's a bit similar to probably our GPs, right? You have to consider whether you have the capital requirements to be able to bid for some of these projects. You get
capital requirement.
Okay, when you register a foreign-owned private limited company in Indonesia, right? You need to show, regardless of whichever company, right? You need to show that you have in the bank 10 billion rupiah, which is about 660,000 USD. Okay, that's for any private limited company setup, right? to show that you're able to finance your business cost of operation, correct? Then I think subsequently for this e-catalog, depending on what you're supplying, you probably need to submit proof that you can fulfill the contract, right? So there are probably certain things that you need to be aware of also in terms of your whether you're able to bid for certain projects. Yeah.
But but Tiffany, I think when you mentioned this e-catalog system, I think it's still important for private market according to the research. They will take it as a reference. So please take a look.
Okay, thank you, Jay, and thank you, Ryan. I'll
Okay.
read more about this.
Excellent.
Yeah.
Can I just comment more on the business problem for Indonesia? I think although sometimes there's a bit of problem with maybe having problems with your first distributor that you signed, right? You're new to the market and you might not have a wide selection. Your network is not so strong, so you might have that difficulty. But at the same time, when you are setting up a foreign entity in Indonesia, right? First, you have to set up your private limited company, and when you're doing that, you actually come under BKPM. BKPM is like our Singapore's MTI or EDB. Basically, it's like the agency that supports foreign companies either setting up business there or investing there, correct? And the process is that you will send your business plan to them, then they will look at it and then get back to you before they allow you to set up a private limited company there, right? So I would say that if you have communicated your intention with this entity, right, this ministry, right, and you say we are bringing in this very innovative product or technology or pharmaceutical or whatever, right, and then this is our plan, right. If you do encounter problems, right, and if you have previously informed the agency on this, you can go back to them and say, hey, we invested, we put in effort, we put in resources, and then subsequently we are having issues, then you can go one level higher, right? So that might be a way to think about it. If you're having difficulties trying to change and you find that you're being locked somewhere, there is an agency in the Indonesia's government to help you with this kind of issues faced by foreign companies. Yeah. So that's my point. Thanks.
Okay, good. Thank you. And again, for the interest of time, maybe we got some more questions, but I think feel free to reach out to Andrew accordingly for more information. And but the thing is, Ryan, today really appreciate your time. Normally this time we will try to take a good photo. If the team's okay, turn on your camera briefly, and then we do a screenshot thing like that. Ryan, you can stop sharing your screen.
Okay. Wait on. Stop presenting.
Okay, then I see more picture. Because sometimes good to meet with some old friend, like that. I need to make sure Ryan are ready at least. So Ryan, you ready for the photo?
Yes.
I saw Fong as well, good, and my two intern, Queenie and Caspar. That's good. Excellent. So I take this one, okay? So when I say 1, 2, 3, you need to keep yourself not moving for a few seconds because the screenshot is not that quick. So after 1, 2, 3, you still don't move, okay? 1, 2, 3. Okay, my God, this is always challenging to me. Give me a second. Okay, good. I make it, and I will send it to our WhatsApp group. Okay, for a record again, but thank you everyone time, and also particularly to Ryan for your sharing. Have a
Okay.
good day.
Yeah. I will leave the QR code for people to just scan in if you need. Yeah.
Oh, you can leave it in the WhatsApp group because somebody's maybe left already. Half of them left already.
Sure.
Yeah.
Okay.
But thank you, Ryan,
Okay. Everyone.
for your sharing.
Okay. 唔該，多謝你。拜拜。
Thank you. Thank you. Good day.
拜拜。